Muy buen día, mi nombre es Alejandra Aguirre, promotora de salud del Centro Médico Alivio, con la diferencia entre cuarentena y aislamiento.
Hello, I'm Yesenia Cervantes. We are going to be reviewing this information in English as well. So after Alejandra explains it in Spanish, I will do the English component.
Sí, como lo dice Yesenia, lo vamos a hacer en inglés y en español. Pues es importante que sepamos identificar la cuarentena y el aislamiento. ¿Cuándo vamos a realizar la cuarentena? La vamos a realizar cuando sepamos que estuvimos en contacto con una persona positiva al COVID-19. Nos debemos de quedar en casa por 14 días después del último contacto con esta persona. Es importante que estemos monitoreando nuestros síntomas. Si llegamos a presentar fiebre, diarrea, dolores de cabeza, dolor muscular, pérdida del olfato, pérdida del gusto. Entonces es importante que estemos monitoreando estos síntomas. Recuerden, es muy importante. Los síntomas aparecen del día 2 al día 14. También muchas de las veces, pues sabemos que estamos en contacto con una persona y al siguiente día, luego queremos irnos a realizar la prueba. Lo mejor es que esperemos de 3 a 5 días para ir a realizarnos la prueba. Ahora vamos a hablar un poquito del aislamiento. El aislamiento se le indica a una persona que tiene el virus, que ha dado positivo al COVID-19. Es importante, muy importante, que se mantenga alejado del resto de las personas que viven en su hogar. De preferencia que se mantengan en un cuarto, solitos, aislados. Si pueden subirse al ático o bajarse al basement, estaría muchísimo mejor para que no estén en contacto con el resto de la familia. El aislamiento también se realiza por 14 días. Después de haber salido positivo, a los 10 días, si ya no presenta síntomas por 3 días, entonces usted puede terminar su aislamiento. Pero si pasa lo contrario, que esté presentando síntomas después de los 10 días del resultado, entonces usted todavía deberá mantenerse en aislamiento porque aún es altamente contagioso. Es muy importante lo que les comenté al principio, que nos mantengamos aislados del resto de la familia, que no salgamos, por favor, que nos mantengamos en un cuarto. Si hay la necesidad de compartir baño, pues entonces sí, nosotros y el resto de la familia pues tiene que usar una mascarilla para evitar algún tipo de contagio. No es necesario que ustedes vayan a la tienda. Si tienen familiares que les puedan proveer los alimentos, dejárselos en la puerta de su casa, estaría perfecto. Únicamente hay que salir si se tiene la necesidad de ir al doctor de emergencia. En la clínica Alivio están realizándose las pruebas del COVID. Usted puede llamar al 773-254-1400 para programar su cita, porque recuerde, ahorita se están atendiendo por cita, no es que como vayan llegando, ya ahorita ya cambió la modalidad, únicamente es por cita. También si ustedes tienen alguna duda, alguna pregunta, que quieran encontrar algún recurso, pueden llamarme al 773-843-2406 o enviarme un correo electrónico a aguirre@aliviomedicalcenter.org.
Hello, everyone. Thank you for sticking around. My name again is Yesenia Cervantes. I'm a community health worker at Alivio. And we're here today to bring a little clarification on two very important topics, which are quarantine versus isolation, which we all need to have clear so we can do them correctly. So quarantine is intended to keep someone who was in close contact with the person who tested positive for COVID-19 away from others. Now, this doesn't mean that you have it, but it's in case that you do and that you develop symptoms that you're not spreading it to other people. So if you had close contact with somebody who had COVID-19, you have to quarantine for 14 days. And that is because it typically takes that long for symptoms to first appear if you do in fact have COVID-19. You should be staying home, not going out at all to any stores or any work. Anything that you have to do has to be within the home. And while you're in quarantine, you are checking your temperature twice a day. And let's remember that while high fever is one of the symptoms, it doesn't always show up, and it's not the only symptom. We know about the cough, shortness of breath, difficulty breathing, intense fatigue, headaches, body aches, confusion, even the sense of taste or smell is gone. And we also have the cases that are symptomatic, which means you do not present any of these cases. So if you decide to get a test done for COVID-19, and because you were exposed to somebody and you want to know while you're in quarantine whether you have it or not, you have to wait 3 to 5 days after you knew you were in contact with somebody who tested positive. Wait 3 to 5 days to get your own COVID-19 testing done. That is because we don't want to receive a false negative, meaning that you went too soon and your body didn't yet detect or show that you had COVID-19. And we don't want someone who does in fact have COVID-19 believing that they don't, because then you're not taking care of yourself and you're not taking care of the rest of the public, which you might infect if you go out. Remember to please try your best to stay away from people who are higher risk of getting seriously ill with COVID-19. And that is people who are immunocompromised, pregnant women, elderly, or they're undergoing some type of medical treatment that's serious, like cancer patients, people who had a recent heart attack or have health conditions that require medical attention. It's best to stay away from them, because if they become sick with COVID-19, they have it's more likely that they will become severely ill. Now, going to isolation, which is very similar to quarantine, but isolation specifically for people who already know are sick with COVID-19, who already got their test. And it's positive. So what do you do when you know that you are in fact positive for COVID-19? You have to stay home, and not only stay home, but you have to eliminate all contact, physical contact, close contact with anybody else in the household. Especially, of course, if they are not sick. You have to, the best would be to have your own sick room, right? Where you're spending your days just by yourself, not in close contact with anybody. And you want to do this for at least 10 days after you got your positive COVID-19 test result. You can come out of isolation after 10 days of a positive test, but you have to meet the following criteria. Your symptoms have to be improving. You have to have at least 3 days of not having any fever without medication. So you have been feeling better, you haven't had a fever for at least 3 days, and no medication to aid that. And it's been at least 10 days since you first got your COVID positive test result, then you can end isolation. There are 2 simple reasons why we don't want somebody ending isolation soon. One, the first most important one, is because you can pass it on to somebody else. You're highly contagious, and chances are somebody else will get it from you. The other reason is also because you need to take as much rest as possible so that you get better. And so if you come out too soon, you're also putting yourself at risk of further exacerbating your symptoms. Remember that there are people who test positive for COVID-19 who will not have any symptoms. Now, those people are very fortunate. Good for them. I'm glad that there are people who get through this without severe consequences, but you still have to isolate because you're still highly contagious. So you have to wait a minimum of 10 days after you get your COVID positive test result. And you should also call your doctor to make sure that they, whether they want to test you again or not. And sometimes work requires a second test for you to be able to go back. remember that if you live with others, you have to have specific rooms. If you are in a home that's large enough that has an extra bathroom, it's best to have a designated bathroom for the people or the person who's sick. But if you have to share areas like a kitchen or bathroom, please disinfect everything after you use it. If the person's too sick, then the caretaker should be disinfecting all common areas right after the person used it. And everybody in the household should be wearing a face mask that correctly covers from nose to under the chin, so the nose and the mouth area. And you have to have remain distant from the person who's sick. This is the best way you can take care of them, by staying healthy yourself. Now it's required that you make an appointment to get COVID-19 testing. So if you in fact need testing, the number is appearing at the bottom for Alivio, 773-254-1400. Now, unfortunately, cases are increasing, so you might need to keep trying, but keep looking for the test if you need to take it. It's important that we get tested if we know we're in contact with somebody or if we're experiencing symptoms. And it's also very important, I urge everybody to seek immediate health care if you are experiencing symptoms that have gotten out of hand, if you're having too much trouble breathing, if you're not getting better, if your symptoms are getting worse, then please don't hesitate to seek medical attention. So I hope that this information was helpful. Remember that we are best kept healthy if we take care of each other. So you can reach me with any questions. My name again is Yesenia Cervantes. You can reach me at ycervantes@aliviomedicalcenter.org or at 773-843-2404. We can help you look for resources in your community so that you are able to keep your quarantine or your isolation at home and don't need to go out. This is also a time to, not be proud. If you have family or friends in your area that can maybe drop off groceries at your front door, ask for that help. We all need it once in a while, and this is a time to reach out to those that can help us.